Question 1. System analysis indicates that a patient presents with a chief complaint of discomfort in the temporomandibular joint area, but clinical examination reveals no obvious malocclusion or skeletal discrepancies. The patient's panoramic radiograph shows some degenerative changes in the condyles. What is the most appropriate initial step in the diagnostic process for a certified orthodontic assistant? Option A. Immediately initiate treatment to address the degenerative changes noted on the panoramic radiograph, as this is the most significant objective finding. Option B. Thoroughly document the patient's reported symptoms, medical history, and any previous treatments, alongside a comprehensive clinical examination and review of all diagnostic records, including radiographs, to identify potential contributing factors to the discomfort. Option C. Advise the patient that orthodontic treatment is not indicated since no malocclusion is evident, and the discomfort is likely unrelated to their bite. Option D. Focus solely on the degenerative changes observed on the radiograph and recommend a referral to a specialist without further diagnostic investigation by the orthodontic team. Correct answer is B. Thoroughly document the patient's reported symptoms, medical history, and any previous treatments, alongside a comprehensive clinical examination and review of all diagnostic records, including radiographs, to identify potential contributing factors to the discomfort. Explanation. Scenario analysis. This scenario presents a common challenge in orthodontic diagnosis where a patient's reported symptoms and observable clinical signs appear to be in conflict. The professional challenge lies in accurately interpreting these discrepancies to formulate a diagnosis that is both comprehensive and patient-centered, while adhering to established diagnostic protocols. Over-reliance on a single piece of information, whether subjective patient report or objective clinical finding, can lead to an incomplete or inaccurate diagnosis, potentially resulting in inappropriate treatment planning. This necessitates a systematic approach that integrates all available data. Correct approach analysis. The correct approach involves a thorough and systematic integration of all diagnostic data. This includes meticulously documenting the patient's chief complaint and medical/dental history, conducting a comprehensive clinical examination, including intraoral and extraoral assessments, and critically evaluating all diagnostic records, radiographs, photographs, study models. This multifaceted approach ensures that all relevant information is considered, allowing for a more accurate assessment of the underlying orthodontic problem. Adherence to these established diagnostic steps is a fundamental requirement for ethical and competent orthodontic practice, as outlined by professional standards and regulatory guidelines for certified orthodontic assistants. It minimizes the risk of misdiagnosis and ensures that treatment planning is based on a complete understanding of the patient's needs. Incorrect approaches analysis. Prioritizing only the patient's subjective report of pain without a thorough clinical and radiographic evaluation would be an ethical and regulatory failure. This approach neglects the objective evidence required for a definitive diagnosis and could lead to treating symptoms rather than the root cause, potentially causing harm or ineffective treatment. Similarly, focusing solely on radiographic findings without considering the patient's history or clinical presentation is also problematic. Radiographs provide valuable information, but they are only one piece of the diagnostic puzzle. Ignoring the patient's subjective experience or observable clinical signs can lead to a diagnosis that does not align with the patient's actual needs or functional concerns. This constitutes a failure to conduct a comprehensive diagnostic workup as expected of a certified orthodontic assistant. Relying solely on visual assessment without corroborating with patient history or diagnostic records is another failure. While visual assessment is crucial, it is insufficient on its own. Diagnostic records and patient history provide context and objective data that are essential for a complete and accurate diagnosis. Professional reasoning. Professionals should approach diagnosis by first understanding the patient's chief complaint and relevant history. This is followed by a systematic clinical examination, both intraoral and extraoral. Subsequently, all diagnostic records, including radiographs, photographs, and study models, are meticulously reviewed and correlated with the clinical findings and patient history. Any discrepancies are investigated further. This integrated approach ensures that the diagnosis is based on a holistic understanding of the patient's condition, minimizing diagnostic errors and leading to appropriate treatment planning. Question 2. The risk matrix shows that a patient is expressing significant concern about the appearance of their teeth, but the initial diagnostic records suggest that achieving ideal functional occlusion and long-term stability will require a treatment approach that may not fully satisfy the patient's aesthetic desires. As a certified orthodontic assistant, which of the following best reflects the appropriate approach to managing this situation in alignment with the goals of orthodontic treatment? Option A. Focus exclusively on addressing the patient's aesthetic concerns to ensure their immediate satisfaction, even if it means compromising on the ideal functional occlusion or long-term stability. Option B. Recommend alternative treatment modalities that may not be within the scope of standard orthodontic care, but could potentially achieve the patient's desired aesthetic outcome more rapidly. Option C. Document the patient's aesthetic concerns but proceed with treatment solely based on the orthodontist's assessment of functional and stability goals, without further discussion of aesthetic outcomes with the patient. Option D. Prioritize achieving the ideal functional occlusion and long-term stability as determined by the orthodontist, while ensuring clear communication with the patient about the limitations and benefits of the proposed treatment plan regarding their aesthetic concerns. The correct answer is D. Prioritize achieving the ideal functional occlusion and long-term stability as determined by the orthodontist, while ensuring clear communication with the patient about the limitations and benefits of the proposed treatment plan regarding their aesthetic concerns. Explanation. The risk matrix shows potential complications and patient dissatisfaction if orthodontic treatment goals are not clearly defined and achieved. This scenario is professionally challenging because it requires the certified orthodontic assistant, COA, to understand and contribute to treatment planning that balances multiple, sometimes competing objectives. The COA must recognize that, while aesthetics are often a primary patient concern, functional occlusion and long-term stability are equally critical for overall oral health and treatment success. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of all established orthodontic treatment objectives as outlined by the supervising orthodontist, and in accordance with COA scope of practice guidelines. This involves actively participating in discussions about aesthetics, function, and stability, ensuring that patient expectations are aligned with achievable outcomes, and documenting progress towards these multifaceted goals. This aligns with ethical obligations to provide competent care and uphold patient well-being by ensuring treatment addresses not just appearance, but also long-term oral health. An incorrect approach that focuses solely on aesthetic improvements without considering functional occlusion or long-term stability fails to meet the comprehensive objectives of orthodontic treatment. This could lead to relapse, temporomandibular joint issues, or other functional problems, violating the ethical duty to provide complete and effective care. Another incorrect approach that neglects patient-reported aesthetic concerns in favor of purely functional or stability goals may lead to patient dissatisfaction and a perception of incomplete treatment, potentially undermining trust and adherence to post-treatment recommendations. This could be seen as a failure to adequately address patient needs and expectations within the scope of orthodontic care. The professional decision-making process for similar situations should involve a thorough understanding of the patient's chief complaint, the orthodontist's diagnostic findings, and the established treatment plan. The COA should actively seek clarification on the relative importance of aesthetic, functional, and stability goals for each individual patient. They should then ensure that all actions and observations during treatment are geared towards achieving these integrated objectives, communicating any concerns or deviations from the plan to the supervising orthodontist. Question 3. Process analysis reveals that an orthodontic practice is considering implementing advanced 3D imaging and digital model analysis software to enhance diagnostic capabilities. What is the most appropriate initial step for the certified orthodontic assistant, COA, to ensure the successful and compliant integration of this new technology? Option A. Delegate the responsibility of learning and implementing the new digital imaging system to the newest team member, assuming they will quickly grasp the technology through trial and error. Option B. Focus solely on acquiring the digital images and defer all aspects of digital model analysis and interpretation to the orthodontist, regardless of the software's capabilities for assistant-level tasks. Option C. Immediately begin using the new software for all patient imaging and analysis as soon as it is installed, assuming the manufacturer's basic operational guide is sufficient for all tasks. Option D. Proactively research and complete comprehensive training on the new software, focusing on its operational use, data management, and relevant patient privacy regulations, and then collaborate with the orthodontist to develop clear protocols for its application within the COA's scope of practice. The correct answer is D. Proactively research and complete comprehensive training on the new software, focusing on its operational use, data management, and relevant patient privacy regulations, and then collaborate with the orthodontist to develop clear protocols for its application within the COA's scope of practice. Explanation. Scenario analysis. This scenario presents a common implementation challenge in orthodontic practices, integrating new digital imaging technologies while ensuring patient safety, data integrity, and compliance with established professional standards. The challenge lies in balancing the benefits of advanced imaging, such as improved diagnostic accuracy and treatment planning, with the need for proper training, equipment maintenance, and adherence to privacy regulations. A critical aspect is ensuring that the use of digital imaging, particularly 3D imaging and digital model analysis, aligns with the Certified Orthodontic Assistant (COA) scope of practice and any specific state or national board regulations governing dental auxiliaries. Correct approach analysis. The correct approach emphasizes a systematic and compliant integration of digital imaging. This involves ensuring that all staff members who will operate or interpret digital imaging equipment receive comprehensive training that covers not only the technical operation, but also the ethical and regulatory considerations. This includes understanding patient privacy laws, e.g., HIPAA in the U.S., data security protocols, and the specific limitations of their role in interpreting diagnostic information. Regular calibration and maintenance of equipment are crucial for ensuring diagnostic accuracy and patient safety, directly aligning with the principle of providing competent and safe patient care, a cornerstone of professional practice and regulatory compliance. This approach prioritizes patient well-being and legal adherence. Incorrect approach is analysis. One incorrect approach involves immediate widespread adoption of new digital imaging software without adequate staff training. This poses a significant risk of misinterpretation of images, improper data handling, and potential breaches of patient confidentiality, violating ethical obligations and potentially specific regulatory requirements for data security and professional competency. Another incorrect approach is to rely solely on manufacturer-provided training for digital imaging equipment. While manufacturer training is valuable, it may not cover all aspects of clinical application, ethical considerations, or specific jurisdictional regulations relevant to the COA role. Over-reliance on this can lead to gaps in understanding, potentially resulting in suboptimal patient care or non-compliance with professional standards. A third incorrect approach is to delegate the interpretation of complex 3D imaging data to assistants without proper oversight or defined protocols. While COAs may assist in data acquisition and preliminary analysis, the ultimate diagnostic interpretation typically falls under the purview of the orthodontist. Unauthorized or unqualified interpretation can lead to diagnostic errors and ethical breaches, exceeding the assistant's scope of practice and potentially violating regulatory guidelines. Professional reasoning. Professionals facing this implementation challenge should adopt a phased and evidence-based approach. This involves thorough research into available technologies, understanding their clinical utility and limitations, and assessing their compatibility with existing practice workflows. Crucially, it requires a proactive engagement with regulatory bodies and professional organizations to ensure all implementation steps align with current laws and ethical guidelines. A robust training program, ongoing competency assessment, and clear protocols for data management and interpretation are essential. Decision-making should prioritize patient safety, data security, and the ethical delivery of orthodontic care, always within the defined scope of practice for the Certified Orthodontic Assistant. Question 4. Market research demonstrates that advanced diagnostic tools like cone beam computed tomography, CBCT, are increasingly utilized in orthodontic practices for enhanced treatment planning. A Certified Orthodontic Assistant, COA, is preparing to perform a CBCT scan on a patient as prescribed by the orthodontist. What is the most appropriate action for the COA to take prior to initiating the scan? Ensuring compliance with regulatory and ethical standards. Option A. Suggest to the patient that a standard panoramic X-ray might be sufficient, and offer to perform that instead if they are concerned about radiation. Option B. Ask the patient if they have any questions about the scan but do not provide detailed explanations of risks or benefits, as that is the orthodontist's responsibility. Option C. Proceed with the CBCT scan immediately upon receiving the orthodontist's written prescription, as the prescription itself implies patient consent. Option D. Confirm with the patient that they understand the purpose of the CBCT scan, the procedure involved, and the associated risks and benefits, and ensure the orthodontist's prescription is clear. The correct answer is D. Confirm with the patient that they understand the purpose of the CBCT scan, the procedure involved, and the associated risks and benefits, and ensure the orthodontist's prescription is clear. Explanation. Scenario analysis. This scenario presents a professional challenge related to the ethical and regulatory implications of using advanced diagnostic technology, specifically cone beam computed tomography, CBCT, in orthodontic practice. The challenge lies in balancing the potential benefits of enhanced diagnostic information with the imperative to adhere to patient safety, informed consent, and responsible use of radiation, all within the framework of the Certified Orthodontic Assistant, COA, regulatory guidelines. A COA must understand not only the technical operation of such equipment, but also the underlying principles of radiation safety and patient rights. Correct approach analysis. The correct approach emphasizes the COA's role in facilitating informed consent by ensuring the patient understands the necessity and implications of the CBCT scan. This aligns with regulatory requirements for patient autonomy and the ethical principle of beneficence, which mandates acting in the patient's best interest. By verifying the orthodontist's prescription and confirming the patient's understanding of the procedure, risks including radiation exposure, and benefits, the COA upholds professional standards. This proactive approach ensures that the diagnostic tool is used appropriately, minimizing unnecessary radiation exposure and respecting the patient's right to make informed decisions about their health care. This is directly supported by COA guidelines that stress patient education and adherence to prescribed diagnostic procedures. Incorrect approach is analysis. Proceeding with the CBCT scan without confirming the patient's understanding of the procedure and its implications represents a failure in informed consent. This violates patient autonomy and potentially exposes the patient to unnecessary radiation without their full comprehension of the risks and benefits, which is a direct contravention of patient safety regulations and ethical practice. Performing the scan solely based on the orthodontist's prescription, without any patient interaction or verification of understanding bypasses, a crucial step in patient care. While the orthodontist's prescription is essential, the COA has a responsibility to ensure the patient is adequately informed, especially when advanced technologies involving radiation are involved. This oversight can lead to ethical breaches and potential regulatory noncompliance regarding patient rights. Suggesting alternative, less informative diagnostic methods without the orthodontist's explicit instruction or patient consent is outside the COA's scope of practice and could compromise the diagnostic accuracy and subsequent treatment planning. The COA's role is to support the orthodontist's diagnostic decisions, not to independently alter them, especially when it involves potentially less effective diagnostic tools. This undermines the established diagnostic pathway and professional hierarchy. Professional reasoning. Professionals should approach situations involving advanced diagnostic technologies by prioritizing patient safety and informed consent. This involves a clear understanding of the technology's purpose, its associated risks, particularly radiation exposure, and the patient's right to information. The decision-making process should begin with verifying the necessity of the diagnostic tool as prescribed by the supervising orthodontist. Subsequently, the COA must engage with the patient to explain the procedure in understandable terms, address any concerns, and confirm their comprehension and agreement. This collaborative approach ensures that the use of advanced technology is both clinically justified and ethically sound, adhering strictly to the regulatory framework governing orthodontic assistance. Question 5. Process analysis reveals that a new patient presents with the first permanent molars in a Class I relationship, but the canines exhibit a significant overjet. the incisors show a moderate crowding. When documenting this case for the orthodontist, which classification best captures the nuances of this malocclusion according to Engel's system and its common variations? Option A. Class I malocclusion with anterior crowding and canine class Roman II tendency. Option B. Class Roman II Division I malocclusion. Option C. Class Roman III malocclusion with canine interference. Option D. Class I malocclusion with significant anterior crowding. The correct answer is A. Class I malocclusion with anterior crowding and canine class Roman II tendency. Explanation. Scenario analysis. Accurately classifying malocclusions is fundamental to orthodontic diagnosis and treatment planning. Misclassification can lead to inappropriate treatment strategies, potentially prolonging treatment time, increasing costs, and failing to achieve optimal functional and aesthetic outcomes for the patient. The challenge lies in discerning subtle variations within Engel's classification, especially in mixed dentition or when dealing with complex skeletal and dental relationships. Correct approach analysis. The correct approach involves a systematic evaluation of the anterior-posterior relationship of the first permanent molars and canines, considering both skeletal and dental components. This aligns with the foundational principles of orthodontic diagnosis, as taught and expected within the scope of practice for a certified orthodontic assistant, COA. A thorough understanding of Engel's classification, including its subdivisions and variations, allows for precise communication with the orthodontist and contributes to evidence-based treatment planning, which is implicitly supported by professional standards of care. Incorrect approaches analysis. One incorrect approach would be to solely focus on the anterior teeth without considering the posterior occlusal relationships. This fails to adhere to Engel's original classification system, which is based on the molar relationship, and can lead to misdiagnosis. Ethically, this represents a failure to apply established diagnostic criteria, potentially compromising patient care. Another incorrect approach is to oversimplify the classification by only identifying broad categories, Class I, Roman II, Roman III, without recognizing or documenting subdivisions or variations. This lack of detail can hinder effective communication and treatment planning, as it doesn't capture the nuances of the malocclusion. This can be seen as a failure to meet the expected standard of diagnostic thoroughness. A third incorrect approach would be to rely on patient self-diagnosis or anecdotal information rather than objective clinical assessment. This bypasses the professional responsibility to conduct a proper examination and apply established diagnostic principles, which is a direct ethical and professional failing. Professional reasoning. Professionals should approach malocclusion classification by first establishing the molar relationship, then the canine relationship, and subsequently evaluating the incisor relationship. This systematic process, combined with an understanding of skeletal versus dental discrepancies and the recognition of common variations, e.g., end-to-end bite, anterior crossbite, ensures accurate diagnosis. When in doubt, consulting with the supervising orthodontist or referring to established orthodontic textbooks and diagnostic aids is crucial for maintaining professional competence and ethical practice. Question 6. Quality control measures reveal a pattern of recurring treatment challenges in cases presenting with Class Roman II malocclusions. As a certified orthodontic assistant, which of the following risk assessment approaches would best contribute to understanding the underlying etiology and informing treatment strategies? Option A. Prioritizing a detailed assessment of the patient's oral habits, dietary patterns, and any history of mouth breathing or thumb sucking, alongside a review of family orthodontic history. Option B. Emphasizing the patient's current aesthetic concerns and perceived social impact of the malocclusion as the sole drivers for treatment decisions. Option C. Assuming that all Class Roman II malocclusions are primarily due to a genetic predisposition and require a standard fixed appliance approach. Option D. Focusing exclusively on the severity of the overjet and the degree of molar relationship as the primary indicators for treatment planning. The correct answer is A. Prioritizing a detailed assessment of the patient's oral habits, dietary patterns, and any history of mouth breathing or thumb sucking, alongside a review of family orthodontic history. Explanation. This scenario presents a professional challenge because it requires the certified orthodontic assistant, COA, to move beyond simply identifying a malocclusion to understanding its underlying causes, which directly impacts the treatment planning and patient education process. A thorough understanding of etiology is crucial for providing comprehensive care and ensuring patient safety and satisfaction. The correct approach involves a comprehensive risk assessment that considers the multifactorial nature of malocclusion, encompassing genetic predispositions, environmental influences, and developmental anomalies. This aligns with the COA's ethical responsibility to contribute to patient care based on sound scientific principles and to support the orthodontist in developing individualized treatment plans. By evaluating all potential contributing factors, the COA assists in identifying the most effective and appropriate interventions, thereby upholding the standard of care expected within the orthodontic profession and adhering to guidelines that emphasize evidence-based practice. An incorrect approach that focuses solely on observable clinical signs without investigating the etiology would be professionally deficient. This fails to acknowledge the complexity of malocclusion and could lead to incomplete or ineffective treatment strategies. Ethically, this approach neglects the duty to provide thorough and informed care. Another incorrect approach that dismisses the role of environmental factors in favor of a purely genetic explanation oversimplifies the etiology and may overlook modifiable risk factors that could be addressed. This is a failure to apply a holistic understanding of patient health. Finally, an approach that prioritizes immediate aesthetic concerns over a deeper understanding of developmental influences risks addressing symptoms rather than root causes, potentially leading to relapse or suboptimal long-term outcomes. This demonstrates a lack of comprehensive diagnostic reasoning, which is a cornerstone of professional orthodontic practice. The professional decision-making process for similar situations should begin with a thorough review of the patient's history, including family history for genetic predispositions, lifestyle and habits for environmental influences, and developmental milestones. This information should then be correlated with clinical findings and radiographic evidence. The COA should then collaborate with the orthodontist to synthesize this data, facilitating a discussion about the most probable etiologic factors and their implications for treatment. This systematic, evidence-based approach ensures that all relevant factors are considered, leading to a more accurate diagnosis and a more effective, patient-centered treatment plan. Question 7. Operational review demonstrates that a certified orthodontic assistant COA is responsible for fabricating study models. During the pouring of a set of models, the assistant notices the alginate impression has begun to set but is still somewhat pliable. To expedite the process, the assistant decides to pour the models immediately without allowing the impression material to fully set and rebound. Additionally, the assistant plans to trim the models to a basic shape without articulating them and will only label them with the patient's initials. Which of the following approaches best aligns with professional standards for study model fabrication and analysis? Option A. Pour the models immediately after the impression material has begun to set, trim them to a basic shape without articulation, and label them with the patient's initials. Option B. Discard the impression and retake it. Pour the models after the impression material has fully set, and label them with the patient's initials. Option C. Pour the models immediately after the impression material has begun to set, articulate and trim the models, and label them with the patient's full name and date of fabrication. Option D. Discard the impression and retake it to ensure a complete and accurate set of the impression material before pouring the models. Then articulate and fully trim the models, labeling them with the patient's full name, date of birth, and date of fabrication. The correct answer is A. Pour the models immediately after the impression material has begun to set, trim them to a basic shape without articulation, and label them with the patient's initials. Explanation. This scenario presents a challenge in maintaining the integrity and utility of diagnostic records within the scope of orthodontic practice. The core issue revolves around ensuring that study models accurately reflect the patient's dentition at a specific point in time, which is crucial for diagnosis, treatment planning, and progress monitoring. The Certified Orthodontic Assistant, COA, has a responsibility to adhere to established protocols for model fabrication and handling to ensure their diagnostic value is preserved, and that patient records are maintained in accordance with professional standards and any applicable state board regulations regarding record keeping. Correct approach emphasizes meticulous attention to detail during the fabrication process and appropriate storage to prevent distortion or damage. This aligns with the ethical obligation to provide competent care and maintain accurate patient records, which are foundational to the practice of orthodontics. Adherence to manufacturer instructions for materials and proper handling techniques ensures the models are a reliable representation of the patient's oral structures, supporting sound clinical decision-making. An incorrect approach that involves using a partially set impression material for pouring models introduces significant inaccuracies. This compromises the diagnostic value of the models, as they will not accurately represent the true dimensions and relationships of the teeth and arches. This failure to produce accurate diagnostic records can lead to misdiagnosis and inappropriate treatment planning, potentially harming the patient and violating the standard of care. Furthermore, failing to properly trim and articulate the models prevents a comprehensive assessment of occlusal relationships, a critical component of orthodontic analysis. This oversight can also be seen as a failure to maintain complete and accurate patient records, which may have implications under state dental board regulations. Another incorrect approach, such as neglecting to label the models with essential patient identifiers and the date of fabrication, creates ambiguity and potential for mix-ups. This not only hinders efficient record retrieval, but also poses a risk of misattributing records to the wrong patient, a serious breach of patient privacy and safety. Accurate and complete labeling is a fundamental aspect of good record-keeping practice and is often implicitly or explicitly required by regulatory bodies overseeing healthcare professionals. The professional decision-making process in such situations requires a commitment to accuracy and completeness. A COA should always prioritize following established protocols for impression taking, model pouring, trimming, and labeling. When faced with a situation where a deviation from protocol might seem to save time, the COA must consider the potential impact on diagnostic accuracy, patient care, and regulatory compliance. Consulting with the supervising orthodontist or referring to practice protocols is essential when uncertainty arises. The ultimate goal is to ensure that all diagnostic records are of the highest quality and serve their intended purpose effectively and ethically. Question 8. Assessment of a patient's craniofacial growth and development is crucial for effective orthodontic treatment planning. Considering a 10-year-old patient exhibiting rapid changes in facial structure and significant dental eruption, which of the following best guides the COA's contribution to the treatment planning process regarding growth spurts? Option A. Recommending immediate initiation of comprehensive fixed appliance therapy to capitalize on the rapid growth phase. Option B. Suggesting delaying all orthodontic intervention until the growth spurt has completely subsided to ensure stability. Option C. Focusing solely on the patient's chronological age of 10 years and proceeding with a standard treatment plan for that age group. Option D. Documenting the observed rapid changes and advising the orthodontist that the patient appears to be in a significant growth spurt, necessitating a reevaluation of the treatment timing and approach. Correct answer is A. Recommending immediate initiation of comprehensive fixed appliance therapy to capitalize on the rapid growth phase. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified orthodontic assistant COA to interpret complex craniofacial growth patterns and their implications for orthodontic treatment timing. Misinterpreting growth spurts or their impact can lead to suboptimal treatment outcomes, increased treatment duration, or even the need for retreatment, all of which can negatively affect patient well-being and potentially lead to ethical or professional complaints. The COA must integrate knowledge of skeletal and dental development with clinical observation to make informed recommendations. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's current growth stage, considering both skeletal and dental indicators, and understanding how these relate to potential future growth. This aligns with the COA's role in assisting the orthodontist by providing accurate observations and preliminary assessments. Best professional practice dictates a thorough, evidence-based approach that prioritizes patient-specific factors. This is ethically sound as it aims for the most effective and efficient treatment plan, minimizing patient discomfort and financial burden. Regulatory frameworks for dental professionals emphasize competence and diligence in patient care, which includes understanding and applying principles of growth and development. Incorrect approaches analysis. One incorrect approach would be to solely rely on chronological age to determine treatment readiness. This fails to acknowledge the significant variability in individual growth rates and can lead to premature or delayed treatment, impacting efficacy. Ethically, this is a failure of due diligence and professional competence. Regulatory bodies expect practitioners to assess biological age and growth potential, not just chronological age. Another incorrect approach would be to ignore observable signs of a growth spurt, such as rapid changes in facial proportions or tooth eruption patterns, and proceed with a treatment plan designed for a different growth stage. This demonstrates a lack of clinical observation and an inability to adapt treatment strategies to the patient's dynamic developmental status. This is a direct violation of professional standards of care and could be considered negligence. A third incorrect approach would be to base treatment recommendations solely on parental expectations without a thorough assessment of the patient's growth and development. While patient and parent input is important, the ultimate treatment plan must be guided by sound clinical judgment and scientific principles of orthodontics. Failing to do so prioritizes subjective desires over objective biological realities, which is ethically problematic and professionally unsound. Professional reasoning. Professionals should approach growth and development assessments by first establishing a baseline understanding of normal craniofacial development. This includes familiarizing themselves with typical growth curves and the timing of skeletal and dental milestones. When presented with a specific patient, the decision-making process should involve 1. Gathering all available data, clinical examination, radiographic assessments, e.g., cephalometric analysis, hand-wrist radiographs, and dental models. 2. Analyzing the data, identifying the patient's current skeletal and dental maturity, recognizing any deviations from the norm, and assessing the presence and intensity of growth spurts. 3. Integrating findings, correlating growth patterns with the proposed orthodontic treatment goals and timing. 4. Communicating observations, clearly and accurately relaying findings and their implications to the supervising orthodontist. This systematic approach ensures that treatment decisions are informed, patient-centered, and aligned with best practices and regulatory expectations. Question 9. Comparative studies suggest that the application of continuous, light forces is generally more effective and less damaging for orthodontic tooth movement than intermittent, heavy forces. Considering this principle, which of the following force systems and application methods would be most appropriate for achieving controlled bodily movement of an anterior tooth with minimal risk of root damage or unwanted tipping? Option A. A force system that applies a significant extrusive force to the tooth, even though the treatment plan calls for intrusion, relying on the patient's natural bite to correct the position. Option B. A force system employing heavy, intermittent forces delivered by elastics that are only worn sporadically by the patient, with the goal of rapid tooth repositioning. Option C. A force system utilizing a continuous, light force delivered through a well-fitting arch wire and auxiliary mechanics designed to engage the center of resistance, aiming for a consistent rate of movement. Option D. A force system that primarily generates a tipping moment, with minimal consideration for the tooth center of resistance, assuming that the arch wire will eventually correct any unwanted rotation. The correct answer is C. A force system utilizing a continuous, light force delivered through a well-fitting arch wire and auxiliary mechanics designed to engage the center of resistance, aiming for a consistent rate of movement. Explanation. This scenario presents a professional challenge because it requires the certified orthodontic assistant, COA, to apply biomechanical principles in a way that directly impacts patient treatment outcomes and safety. Misapplication of forces can lead to unintended tooth movement, root damage, or patient discomfort, necessitating a thorough understanding of the underlying mechanics and their clinical implications. Careful judgment is required to select the appropriate force system and application method based on the specific treatment goals and the patient's individual anatomy. The correct approach represents best professional practice because it prioritizes patient well-being and adherence to established orthodontic principles. By understanding that continuous, light forces are generally more effective and less damaging for tooth movement than intermittent, heavy forces, the COA ensures that treatment is both efficient and safe. This aligns with the ethical obligation to provide competent care and the regulatory expectation that orthodontic assistants operate within their scope of practice, informed by sound scientific principles. The focus on controlled force application minimizes the risk of iatrogenic damage and promotes predictable, stable results, which are hallmarks of high-quality orthodontic care. An incorrect approach involving the application of heavy, intermittent forces would be professionally unacceptable due to the high risk of root resorption, gingival recession, and ankylosis, all of which can lead to irreversible damage and compromise long-term treatment success. This directly violates the ethical duty to avoid harm and the implicit regulatory requirement to practice with reasonable skill and care. Another incorrect approach, such as applying forces without considering the center of resistance, could result in unwanted tipping movements instead of controlled bodily translation, leading to inefficient treatment and potential complications. This demonstrates a lack of understanding of fundamental biomechanical principles, which is a failure in professional competence. A third incorrect approach, using a force system designed for a different type of tooth movement, e.g., using a force system for extrusion when intrusion is indicated, would lead to ineffective treatment and potentially prolonged treatment times, which is a disservice to the patient and falls short of professional standards. The professional decision-making process for similar situations should involve a systematic evaluation of the treatment objectives, the specific tooth or teeth to be moved, and the desired direction and type of movement. The COA should then consult with the supervising orthodontist to confirm the appropriate biomechanical strategy, considering the principles of force magnitude, direction, duration, and continuity. This collaborative approach ensures that the chosen force system is not only biomechanically sound, but also tailored to the individual patient's needs and within the scope of the COA's responsibilities. Question 10. The performance metrics show a trend of diagnostic records not being consistently updated between initial comprehensive records and subsequent treatment phases. Which of the following actions best reflects a commitment to maintaining the highest standards of orthodontic record keeping and patient care? Option A. Continue to rely on the initial comprehensive diagnostic records unless a specific request is made by the patient or a new treatment plan is initiated. Option B. Delegate the responsibility of identifying the need for record updates to the front desk staff based on appointment scheduling. Option C. Implement a protocol for mandatory review and potential update of all diagnostic records at a minimum of every 12 months, or sooner if significant clinical changes are observed. Option D. Focus on updating records only when a patient is nearing the end of their active treatment to prepare for retention. Correct answer is C. Implement a protocol for mandatory review and potential update of all diagnostic records at a minimum of every 12 months, or sooner if significant clinical changes are observed. Explanation. This scenario presents a challenge in maintaining the integrity and completeness of orthodontic records, which are crucial for patient care, legal compliance, and professional accountability. The performance metrics highlight a potential gap in the systematic review and updating of diagnostic information. Ensuring that all diagnostic records are current and accurately reflect the patient's current orthodontic status is a fundamental aspect of best practice and regulatory compliance. The correct approach involves a proactive and systematic process of reviewing and updating diagnostic records at regular intervals or when significant clinical changes occur. This aligns with the ethical obligation to provide competent care and maintain accurate patient documentation. Regulatory frameworks, such as those governing dental and orthodontic practice, emphasize the importance of comprehensive and up-to-date patient records. This practice ensures that treatment decisions are based on the most current information, minimizing risks and optimizing outcomes. It also provides a clear and accurate history for future reference, peer review, or legal scrutiny. An incorrect approach would be to rely solely on the initial diagnostic records without periodic review or to only update records when a new treatment phase begins. This could lead to treatment decisions based on outdated information, potentially compromising patient safety and treatment effectiveness. Ethically, this represents a failure to provide ongoing, competent care. Regulatory failure lies in not adhering to standards that require accurate and current patient documentation, which can have legal ramifications. Another incorrect approach is to delegate the responsibility of record review to unqualified personnel without proper oversight, which undermines the professional responsibility of the orthodontist and the certified assistant to ensure the accuracy of patient information. This can lead to errors in diagnosis and treatment planning, violating professional standards and potentially patient trust. The professional decision-making process should involve establishing clear protocols for the regular review and updating of orthodontic records. This includes defining triggers for updates, e.g., annual reviews, significant patient complaints, changes in occlusion or facial profile, and ensuring that all team members understand their roles in this process. When performance metrics indicate a potential issue, A thorough root cause analysis should be conducted to identify the specific breakdown in the process and implement corrective actions. This proactive and systematic approach ensures that patient care is always based on the most accurate and relevant diagnostic information, upholding both ethical and regulatory requirements. Question 11. To address the challenge of obtaining precise skeletal and soft tissue measurements for orthodontic diagnosis, which radiographic modality is most appropriate when specifically requested by the orthodontist for this purpose? Option A, panoramic radiograph. Option B, periapical radiograph. Option C, a combination of panoramic and periapical radiographs. Option D, cephalometric radiograph. The correct answer is D, cephalometric radiograph. Explanation. This scenario presents a professional challenge because it requires the certified orthodontic assistant COA to interpret and act upon radiographic information that is crucial for patient diagnosis and treatment planning. The challenge lies in ensuring that the correct type of radiograph is utilized for the specific diagnostic need, adhering strictly to the established protocols and the dentist's instructions, while also understanding the limitations and applications of each radiographic modality. Misinterpreting the need for a specific radiograph could lead to incomplete diagnostic information, potentially impacting treatment outcomes and patient safety, and could also represent a failure to adhere to professional standards of care. The correct approach represents best professional practice because it demonstrates a thorough understanding of radiographic principles and their application in orthodontics. By selecting the cephalometric radiograph, the COA is adhering to the dentist's explicit instruction and recognizing that this specific imaging technique is designed to provide precise measurements of skeletal and dental relationships, which are fundamental for orthodontic diagnosis and treatment planning. This aligns with the regulatory framework that mandates the use of appropriate diagnostic tools as directed by the supervising dentist and emphasizes the importance of accurate record-keeping and patient care. An incorrect approach involving the selection of a panoramic radiograph would be professionally unacceptable. While panoramic radiographs provide a broad overview of the entire dentition and supporting structures, they lack the detailed, standardized measurements of a cephalometric radiograph. This would fail to meet the specific diagnostic requirements for orthodontic analysis, potentially leading to an incomplete or inaccurate assessment by the orthodontist. Ethically, this would represent a deviation from the dentist's directive and a failure to provide the most appropriate diagnostic information. Another incorrect approach, choosing periapical radiographs, would also be unacceptable. Periapical radiographs are primarily used to visualize individual teeth and their surrounding bone, focusing on root apices and periodontal structures. While valuable for endodontic or periodontal assessments, they do not provide the skeletal and soft tissue analysis necessary for comprehensive orthodontic diagnosis. This choice would fail to meet the diagnostic needs for orthodontic treatment planning and would disregard the specific instructions for a cephalometric study. Finally, an approach that involves taking multiple types of radiographs without a clear directive or diagnostic justification would be inefficient and potentially wasteful of resources. While a comprehensive orthodontic workup might eventually involve various radiographic types, the immediate need, as indicated by the dentist's request for a cephalometric radiograph, is specific. Proceeding without this specific imaging would delay proper diagnosis and treatment planning, and could be seen as a failure to follow instructions and a lack of professional judgment in prioritizing diagnostic needs. The professional reasoning process for similar situations should involve 1. Clearly understanding the dentist's request and the purpose of the radiograph. 2. Recalling or referencing the specific indications and diagnostic value of each type of radiograph, cephalometric, panoramic, periapical, etc. 3. Selecting the radiograph that best fulfills the diagnostic requirements as outlined by the dentist. 4. Confirming any ambiguities with the supervising dentist before proceeding. 5. Ensuring all actions are documented accurately in the patient's record. Question 12. The evaluation methodology shows that a new patient presents for an initial orthodontic consultation. The COA is tasked with gathering comprehensive patient information. Which of the following actions best supports a thorough risk assessment for this patient? Option A. Reviewing any previous orthodontic records provided by the patient without conducting a current clinical examination or inquiring about recent medical changes. Option B. Systematically documenting the patient's complete medical history, including allergies and current medications, alongside a detailed dental history and a thorough clinical examination of the dentition, occlusion, and soft tissues. Option C, focusing primarily on the patient's stated reasons for seeking orthodontic treatment and visually assessing the alignment of their teeth. Option D, prioritizing the collection of demographic information and insurance details before proceeding with any clinical assessment. The correct answer is B, systematically documenting the patient's complete medical history, including allergies and current medications, alongside a detailed dental history and a thorough clinical examination of the dentition, occlusion, and soft tissues. Explanation: this scenario is professionally challenging because the certified orthodontic assistant COA must synthesize a broad range of patient information, including potentially sensitive medical history, with objective clinical findings. The risk assessment requires careful judgment to identify potential contraindications or factors that might influence treatment planning and execution, ensuring patient safety and optimal outcomes. The correct approach represents best professional practice because it prioritizes a thorough and systematic review of all available patient data. This aligns with the ethical obligation to provide competent and safe patient care, as mandated by professional standards and likely reflected in COA certification guidelines, which emphasize comprehensive patient assessment. A detailed medical history can reveal systemic conditions that may affect oral health or necessitate modifications in orthodontic treatment, such as increased risk of infection or delayed healing. Similarly, a comprehensive dental history helps understand past treatments, oral hygiene habits, and any previous orthodontic experiences, all of which are crucial for effective treatment planning. The clinical examination of dentition, occlusion, and soft tissues provides objective data to corroborate or contrast with the patient's reported history, allowing for a holistic understanding of the patient's oral health status. An incorrect approach that focuses solely on the visible dental structures without delving into the medical history would be a significant regulatory and ethical failure. It neglects the fundamental principle of patient-centered care and the COA's responsibility to identify potential systemic influences on oral health, which could lead to adverse events or compromise treatment. Another incorrect approach that prioritizes only the patient's stated chief complaint without a comprehensive clinical examination would also be a failure. This overlooks potential underlying issues or coexisting conditions that might not be immediately apparent to the patient, but are critical for safe and effective orthodontic management. Relying solely on a previous orthodontic record without a current clinical examination and updated history would also be professionally unacceptable, as a patient's oral health and medical status can change significantly over time. Professional reasoning in such situations involves a structured approach. First, actively listen to and document the patient's reported medical and dental history, probing for details and potential implications. Second, conduct a meticulous clinical examination, systematically assessing all relevant oral structures. Third, cross-reference the historical information with the clinical findings, identifying any discrepancies or areas requiring further investigation or consultation. Finally, communicate all pertinent findings and potential concerns to the supervising orthodontist for informed treatment planning and decision-making, adhering to established protocols and ethical guidelines. Question 13. Process analysis reveals that a certified orthodontic assistant COA is reviewing a set of study models for a new patient. The COA is tasked with analyzing tooth size, arch length, and space discrepancies, as well as assessing arch form and symmetry. Which of the following actions best reflects the appropriate and regulatory compliant approach for the COA in this situation? Option A. Conduct precise measurements of tooth dimensions and arch perimeters, calculate the space available and required, and document all findings objectively for the orthodontist's review. Option B. Visually estimate the tooth sizes and arch lengths, noting any apparent asymmetry, and provide a general impression of the space analysis to the orthodontist. Option C. Measure only the teeth that appear to be significantly misaligned and report the arch length as generally adequate, omitting any measurements that suggest a severe space deficiency. Option D. Based on the visual assessment of the models, propose a specific orthodontic treatment approach and appliance selection to the orthodontist. The correct answer is A. Conduct precise measurements of tooth dimensions and arch perimeters, calculate the space available and required, and document all findings objectively for the orthodontist's review. Explanation. This scenario presents a professional challenge because the Certified Orthodontic Assistant, COA, is tasked with interpreting and reporting on study models, a critical component of orthodontic diagnosis and treatment planning. Accurate model analysis is foundational to developing an effective treatment strategy, and any misinterpretation can lead to suboptimal outcomes, patient dissatisfaction, and potential ethical or regulatory breaches. The COA must demonstrate a thorough understanding of anatomical landmarks, measurement techniques, and the implications of findings for arch form, symmetry, and tooth-to-arch discrepancies. The correct approach involves meticulously measuring tooth size and arch length, then calculating the space available and required. This systematic process, when documented accurately and reported to the supervising orthodontist, aligns with the COA's scope of practice as defined by regulatory frameworks governing orthodontic auxiliaries. It ensures that diagnostic information is precise and reliable, forming a solid basis for treatment decisions. This adheres to the principle of providing accurate and complete information to the treating clinician, which is an ethical and often regulatory expectation for all healthcare professionals. An incorrect approach that focuses solely on visual assessment without precise measurements fails to meet the standard of care. While visual cues are important, they are subjective and prone to error. Relying on them exclusively can lead to inaccurate space analysis and a misjudgment of arch form and symmetry, potentially resulting in a flawed treatment plan. This could be considered a failure to exercise due diligence and a deviation from established diagnostic protocols, which may have regulatory implications if it leads to patient harm or substandard care. Another incorrect approach, which involves making definitive treatment recommendations based solely on model analysis without consulting the supervising orthodontist, exceeds the COA's scope of practice. The COA's role is to gather and present data. Treatment planning and prescription are the responsibility of the licensed orthodontist. Such an action would represent a significant ethical and regulatory violation, potentially constituting the unauthorized practice of orthodontics. A further incorrect approach, which involves selectively reporting only the measurements that appear to support a preconceived treatment idea, is a clear ethical breach. This constitutes data manipulation and a failure to provide objective, unbiased information. Such a practice undermines the integrity of the diagnostic process and erodes trust between the COA, the orthodontist, and the patient. Regulatory bodies would view this as professional misconduct. The professional decision-making process for similar situations should involve a commitment to accuracy, objectivity, and adherence to the established scope of practice. COAs should always prioritize precise measurement and thorough documentation. Any findings or interpretations should be clearly communicated to the supervising orthodontist, who is ultimately responsible for diagnosis and treatment planning. When in doubt about a measurement, interpretation, or the appropriate course of action, seeking clarification from the orthodontist is paramount. This ensures that patient care is based on sound, objective data, and that all professional responsibilities are met within the legal and ethical boundaries of the COA role. Question 14. Governance review demonstrates a need to reinforce foundational knowledge among certified orthodontic assistants regarding the interplay between tooth morphology and occlusal harmony. When assessing a patient's dentition for potential orthodontic treatment, which of the following represents the most critical initial step in understanding their current occlusal status and guiding appropriate intervention? Option A. Thoroughly evaluating the patient's existing occlusal relationships, including intercuspation, overjet, overbite, and midline alignment, while simultaneously considering the specific crown and root anatomy of each tooth. Option B. Focusing primarily on the visible crown morphology of the teeth, as this directly influences smile aesthetics and is the most readily observable aspect of dental anatomy. Option C. Prioritizing the aesthetic appearance of the anterior teeth and ensuring they align in a visually pleasing manner, as this is often the primary concern for patients seeking orthodontic care. Option D. Determining the ideal occlusal outcome based on generalized orthodontic principles, without extensive consideration for the patient's unique tooth root anatomy or existing occlusal discrepancies. The correct answer is A. Thoroughly evaluating the patient's existing occlusal relationships, including intercuspation, overjet, overbite, and midline alignment, while simultaneously considering the specific crown and root anatomy of each tooth. Explanation. This scenario is professionally challenging because it requires the Certified Orthodontic Assistant (COA) to interpret and apply detailed knowledge of dental anatomy and occlusion in a practical, patient-centered context, directly impacting treatment planning and execution. The COA must not only possess theoretical knowledge, but also the ability to discern ideal occlusal relationships and their variations, understanding how tooth morphology contributes to these relationships. The correct approach represents best professional practice because it prioritizes accurate assessment of the patient's existing occlusion and tooth morphology as the foundation for any orthodontic intervention. This aligns with the ethical obligation to provide competent and evidence-based care, ensuring that treatment is tailored to the individual patient's needs and aims for a functionally and aesthetically sound outcome. Adherence to established principles of dental anatomy and occlusion, as taught and tested for COA certification, is paramount. An incorrect approach that focuses solely on achieving a specific aesthetic outcome without a thorough understanding of the underlying occlusal scheme and tooth anatomy would be professionally unacceptable. This failure stems from a disregard for the functional implications of orthodontic treatment, potentially leading to iatrogenic problems such as temporomandibular joint, TMJ dysfunction, occlusal instability, or excessive wear. Ethically, this approach breaches the duty of care by not considering the long-term health and function of the patient's dentition. Another incorrect approach that neglects to consider the root anatomy of the teeth when evaluating crown morphology and occlusion would also be a significant professional failing. While crown morphology is visible, root anatomy dictates tooth stability, support, and the potential for movement during orthodontic treatment. Ignoring this fundamental aspect can lead to treatment plans that compromise periodontal health or result in unstable tooth positions. This demonstrates a lack of comprehensive understanding required for safe and effective orthodontic assistance. A further incorrect approach that relies on generalized occlusal standards without considering individual patient variations in tooth morphology and skeletal patterns would be detrimental. Ideal occlusion serves as a benchmark, but orthodontic treatment must account for the unique biological and anatomical characteristics of each patient. Failing to individualize the assessment and treatment approach can lead to suboptimal outcomes and patient dissatisfaction. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's current dentition, including detailed observation of tooth morphology, crown and root, assessment of the existing occlusion, and consideration of the patient's chief complaint and treatment goals. The COA should then correlate these findings with their knowledge of ideal occlusion and tooth movement principles to contribute to a comprehensive and appropriate treatment plan. This process emphasizes critical thinking, accurate diagnosis, and patient-centered care, all within the scope of their certified role. Question 15. Consider a scenario where a young patient is experiencing significant discomfort with their newly fitted twin block appliance and expresses difficulty with speech. The Certified Orthodontic Assistant (COA) has reviewed the patient's chart and recalls the orthodontist's initial instructions regarding appliance insertion and basic wear. What is the most appropriate course of action for the COA? Option A. Instruct the patient to remove the twin block appliance temporarily until their next scheduled appointment and to avoid wearing it until then. Option B. Reassure the patient that some initial discomfort is normal and provide standard instructions on how to clean the appliance, advising them to continue wearing it as directed by the orthodontist. Option C. Immediately attempt to adjust the twin block appliance by slightly bending the acrylic or wires to alleviate the patient's reported discomfort, based on general knowledge of twin block mechanics. Option D. Schedule an immediate consultation with the orthodontist to discuss the patient's specific discomfort and speech difficulties, and to receive further instructions on managing the appliance and educating the patient. The correct answer is B. Reassure the patient that some initial discomfort is normal and provide standard instructions on how to clean the appliance, advising them to continue wearing it as directed by the orthodontist. Explanation. This scenario presents a professional challenge because the Certified Orthodontic Assistant (COA) must balance patient comfort and compliance with the specific clinical directives of the orthodontist, all while adhering to established protocols for appliance management. The application and adjustment of functional appliances like the Herbst and twin block require precise understanding of their biomechanical principles and potential patient-related issues. The COA's role is to execute the orthodontist's treatment plan effectively and safely, ensuring the patient understands the appliance's function and care. The correct approach involves the COA meticulously following the orthodontist's instructions for appliance adjustment, providing clear and concise patient education on oral hygiene and appliance care, and documenting all interventions accurately. This aligns with the COA's scope of practice, emphasizing patient safety, treatment efficacy, and adherence to the treatment plan as directed by the supervising orthodontist. This approach upholds professional responsibility by ensuring the appliance is managed according to established clinical guidelines and the orthodontist's specific treatment objectives, thereby maximizing the potential for successful orthodontic outcomes and minimizing risks to the patient. An incorrect approach of making independent adjustments to the appliance without explicit orthodontist direction represents a significant regulatory and ethical failure. This action exceeds the COA's scope of practice, potentially leading to improper force application, compromised treatment, or patient injury. It undermines the orthodontist's authority and diagnostic judgment, violating the principle of direct supervision and potentially leading to a breach of patient care standards. Furthermore, failing to provide comprehensive patient education on appliance care and hygiene is an ethical lapse, as it compromises the patient's ability to actively participate in their treatment and maintain oral health, increasing the risk of complications such as decalcification or appliance damage. The professional decision-making process in such situations should involve a clear understanding of the COA's defined responsibilities and limitations within the regulatory framework. When faced with a patient experiencing discomfort or questioning appliance function, the COA should first refer to the orthodontist's established treatment plan and protocols. If the situation requires deviation or clarification, the COA must consult directly with the orthodontist before taking any action. Patient education should always be thorough, tailored to the individual's understanding, and reinforced with clear instructions. Accurate and timely documentation of all patient interactions, appliance adjustments, and educational efforts is paramount for continuity of care and professional accountability. Question 16. The investigation demonstrates that the understanding of malocclusion and its correction has evolved significantly over time. Which of the following historical developments is most widely recognized as a foundational step in establishing orthodontics as a distinct scientific discipline, moving beyond empirical observation to a more systematic approach? Option A. The development of early, often crude, appliances for tooth alignment by ancient civilizations. Option B. The introduction of clear aligner technology in the late 20th century, offering a less visible treatment option. Option C. The widespread adoption of fixed appliances in the mid-20th century, enabling more complex tooth movements. Option D. The systematic classification of malocclusions and the articulation of principles for their correction by pioneers like Edward Angle. The correct answer is A. The development of early, often crude, appliances for tooth alignment by ancient civilizations. Explanation. The investigation demonstrates a scenario where an orthodontic assistant is tasked with understanding the foundational principles of orthodontics. This requires not just memorization of facts, but an appreciation for the historical context and the evolution of the field. The challenge lies in discerning which historical development most significantly shaped the modern understanding and practice of orthodontics, requiring a nuanced understanding beyond simple chronological listing. The correct approach represents best professional practice because it accurately identifies a pivotal moment in the history of orthodontics that directly contributed to its scientific foundation and clinical methodologies. This understanding is crucial for an orthodontic assistant to grasp the why behind current practices, fostering better patient communication and adherence to treatment protocols, which aligns with the ethical obligation to provide competent care as outlined by professional standards for certified orthodontic assistants. An incorrect approach that focuses solely on early, rudimentary interventions without acknowledging their limitations or the subsequent scientific advancements fails to grasp the evolution of the field. This would be a regulatory failure, as it demonstrates a lack of comprehensive knowledge required for the COA certification, potentially leading to misinformed patient interactions or an incomplete understanding of treatment rationale. Another incorrect approach that emphasizes purely aesthetic outcomes without considering the underlying biological and biomechanical principles ignores the scientific rigor that defines modern orthodontics. This would be an ethical failure, as it prioritizes superficial results over evidence-based, patient-centered care, which is a cornerstone of professional responsibility. A third incorrect approach that focuses on a single, isolated technological innovation without contextualizing its impact within the broader historical progression of orthodontic thought and practice would also be a failure. This demonstrates a superficial understanding and an inability to connect advancements to the overall development of the discipline, impacting the assistant's ability to contribute effectively to the team's understanding of treatment goals. Professional decision-making in such situations requires a systematic approach. First, understanding the core question being asked. Second, recalling or researching the historical trajectory of orthodontics, identifying key figures, discoveries, and paradigm shifts. Third, evaluating each potential answer against this historical understanding, looking for the most impactful and foundational contribution. And finally, selecting the option that best reflects the scientific and clinical evolution of the specialty. Question 17. Upon reviewing a patient's removable orthodontic appliance, the certified orthodontic assistant, COA, notes that the patient reports significant discomfort and irritation along the gum line where a wire component of the appliance rests. The patient states the discomfort began yesterday. The COA has observed a slight redness in the area but no obvious breakage of the appliance. What is the most appropriate course of action for the COA? Option A. Instruct the patient on proper oral hygiene techniques and advise them to continue wearing the appliance as prescribed, reporting back if the discomfort worsens significantly. Option B. Advise the patient to remove the appliance temporarily until their next scheduled appointment to allow the irritation to subside. Option C. Document the patient's complaint and the observed redness, and then immediately consult with the supervising orthodontist for further evaluation and instructions. Option D. Attempt to gently bend the wire component of the appliance to alleviate pressure, based on previous observations of similar adjustments. The correct answer is A. Instruct the patient on proper oral hygiene techniques and advise them to continue wearing the appliance as prescribed, reporting back if the discomfort worsens significantly. Explanation. This scenario presents a common challenge in orthodontic practice, a patient experiencing discomfort with a removable appliance. The professional challenge lies in balancing patient comfort with the need for effective treatment and adherence to established protocols. It requires careful assessment, clear communication, and appropriate intervention within the scope of practice for a certified orthodontic assistant, COA. The correct approach prioritizes patient well-being and seeks guidance from the supervising orthodontist. This aligns with best professional practice by ensuring that any adjustments or interventions are performed under the direct supervision and authority of the licensed dentist, as mandated by state dental practice acts and COA certification guidelines. The COA's role is to assist the orthodontist, not to independently diagnose or modify treatment plans. This approach upholds ethical standards by ensuring patient safety and maintaining the integrity of the treatment. An incorrect approach would involve the COA attempting to adjust the appliance without direct supervision. This is a regulatory failure as it exceeds the COA's scope of practice, which is defined by state dental boards and professional organizations. Ethically, it poses a risk to the patient by potentially causing further injury or compromising treatment efficacy. Another incorrect approach would be to dismiss the patient's concerns without proper assessment or consultation. This is an ethical failure as it neglects the patient's reported discomfort and fails to provide appropriate care. It also demonstrates a lack of professional judgment by not recognizing the importance of patient feedback in treatment management. Professionals should approach such situations by first actively listening to the patient's concerns and performing a visual assessment of the appliance and oral tissues. Following this, they should document the patient's complaint and the findings, and then promptly communicate with the supervising orthodontist to discuss the situation and receive instructions for management. This systematic approach ensures patient safety, adherence to regulation, and effective collaboration within the dental team. Question 18. Operational review demonstrates that a certified orthodontic assistant, COA, has meticulously compiled a complete set of diagnostic records for a new patient, including radiographs, intraoral scans, and a detailed medical and dental history. The COA has reviewed these records and identified several potential malocclusion characteristics. The COA is aware of the general treatment principles associated with these characteristics. What is the COA's appropriate next step in the diagnostic and treatment planning process? Option A. Formulate a preliminary diagnosis and suggest a potential treatment approach to the supervising orthodontist based on their review of the records. Option B. Selectively highlight specific findings in the diagnostic records that support a particular malocclusion to the supervising orthodontist. Option C. Present the complete diagnostic records to the supervising orthodontist for their independent assessment, diagnosis, and treatment plan formulation. Option D. Discuss the identified malocclusion characteristics and potential treatment options with the patient's parents before consulting the orthodontist. The correct answer is C. Present the complete diagnostic records to the supervising orthodontist for their independent assessment, diagnosis, and treatment plan formulation. Explanation. This scenario presents a professional challenge because the certified orthodontic assistant, COA, is being asked to interpret and act upon diagnostic records without the direct supervision and final assessment of the supervising orthodontist. The COA's role is to assist in patient care, which includes gathering and preparing diagnostic records, but the definitive diagnosis and treatment plan formulation are the exclusive responsibilities of the licensed orthodontist. The complexity arises from the COA's knowledge of orthodontic principles and their ability to recognize potential issues, which might tempt them to overstep their defined scope of practice. The correct approach, which involves presenting the comprehensive diagnostic records to the supervising orthodontist for their independent assessment and diagnosis, represents best professional practice. This aligns with the regulatory framework governing the practice of orthodontics, which mandates that diagnosis and treatment planning are performed by a licensed orthodontist. The COA's adherence to this protocol ensures patient safety and compliance with professional standards. Ethically, it upholds the principle of professional responsibility by ensuring that the ultimate decision-making authority rests with the qualified practitioner. An incorrect approach would be for the COA to independently suggest a diagnosis or treatment plan based on their review of the records. This constitutes a violation of the COA's scope of practice, as defined by regulatory bodies. Such an action could lead to misdiagnosis, inappropriate treatment, and potential harm to the patient, thereby exposing the COA and the practice to legal and ethical repercussions. Furthermore, it undermines the authority and responsibility of the supervising orthodontist. Another incorrect approach would be to selectively present only certain findings to the orthodontist, omitting others that might influence the diagnosis. This is a failure of professional integrity and transparency, potentially leading to an incomplete or inaccurate diagnosis and treatment plan, and is a breach of ethical duty to the patient and the supervising orthodontist. The professional decision-making process in such situations should involve a clear understanding of one's scope of practice and the established protocols within the orthodontic office. When presented with diagnostic records, the COA's primary responsibility is to ensure their completeness, accuracy, and proper organization. Any interpretation or preliminary assessment should be strictly for the purpose of facilitating the orthodontist's diagnostic process, not to replace it. If there are any ambiguities or concerns regarding the records, the COA should communicate these to the supervising orthodontist for clarification, rather than making independent judgments. This systematic approach ensures that patient care remains within the bounds of professional competence and regulatory compliance. Question 19. Examination of the data shows a cephalometric radiograph with several identified landmarks and corresponding measurements. The assistant is tasked with reviewing this analysis to identify any potential issues that might impact the orthodontist's treatment plan. Which of the following actions demonstrates the most appropriate and professionally responsible approach to this task? Option A. Accept the measurements as provided by the cephalometric analysis software without further review, assuming the software is accurate. Option B. Proceed with the interpretation by comparing the measurements to a generic set of ideal values, disregarding any potential variations or the specific diagnostic context of the case. Option C. Focus solely on identifying measurements that fall outside the typical statistical range, without considering the individual patient's unique characteristics or the quality of the tracing. Option D. Verify the accuracy of landmark identification and tracing against established anatomical references, and consider the clinical relevance of the measurements in relation to the patient's overall orthodontic presentation. The correct answer is D. Verify the accuracy of landmark identification and tracing against established anatomical references, and consider the clinical relevance of the measurements in relation to the patient's overall orthodontic presentation. Explanation. This scenario is professionally challenging because it requires the Certified Orthodontic Assistant (COA) to interpret complex diagnostic information derived from cephalometric analysis, which directly impacts treatment planning and patient outcomes. The COA must possess a thorough understanding of cephalometric landmarks, tracing techniques, and the clinical significance of various measurements to identify potential discrepancies or anomalies that might otherwise be overlooked. This requires meticulous attention to detail and a commitment to accuracy, as errors in interpretation can lead to suboptimal treatment or necessitate costly corrections. The correct approach represents best professional practice because it prioritizes patient safety and the integrity of orthodontic treatment by ensuring that the cephalometric analysis is performed and interpreted with the highest degree of accuracy and clinical relevance. This aligns with the ethical obligations of a COA to provide competent care and to support the orthodontist in making informed treatment decisions. Adherence to established protocols for landmark identification and tracing, coupled with a sound understanding of the diagnostic implications of the measurements, is fundamental to upholding professional standards and regulatory compliance within the scope of practice for a COA. An incorrect approach that involves superficial landmark identification or a disregard for the clinical context of cephalometric measurements represents a significant regulatory and ethical failure. Specifically, it violates the principle of providing competent care, as it demonstrates a lack of the necessary knowledge and skill to accurately interpret diagnostic data. This could lead to misdiagnosis, inappropriate treatment planning, and ultimately, harm to the patient, which is a direct contravention of the ethical duty to avoid causing harm. Furthermore, such an approach may fall short of the expected standards of practice as defined by the certifying body and could be considered a breach of professional responsibility. Another incorrect approach, such as relying solely on automated software without critical review or understanding of the underlying principles, also constitutes a regulatory and ethical failure. While technology can be a valuable tool, it is not a substitute for professional judgment. Over-reliance on automated outputs without independent verification or clinical correlation can mask subtle errors or misinterpretations, leading to flawed treatment decisions. This demonstrates a lack of critical thinking and a failure to exercise due diligence, which are essential components of professional practice. The professional decision-making process for similar situations should involve a systematic approach. First, meticulously review the cephalometric radiograph and ensure all landmarks are accurately identified and traced according to established guidelines. Second, critically evaluate the derived measurements, considering their clinical significance in the context of the patient's overall presentation, including their chief complaint, clinical examination findings, and other diagnostic records. Third, consult with the supervising orthodontist regarding any findings that are unclear, unusual, or may significantly influence treatment planning. Finally, maintain accurate and organized records of the analysis and any discussions or decisions made. Question 20. Performance analysis shows a certified orthodontic assistant COA has adjusted a patient's fixed appliance. The patient reports mild discomfort and the assistant observes slight blanching of the gingival tissue around one of the brackets. What is the most appropriate immediate action for the COA? Option A. Continue with the planned adjustments for other teeth, assuming the discomfort and blanching are temporary and will resolve on their own. Option B. Document the patient's reported discomfort and observe tissue blanching, and inform the supervising orthodontist of these findings. Option C. Advise the patient to rinse with warm salt water and schedule a follow-up appointment in 2 weeks without informing the orthodontist. Option D. Ignore the patient's discomfort and the tissue blanching, as these are common occurrences with fixed appliance adjustments. The correct answer is B. Document the patient's reported discomfort and observe tissue blanching, and inform the supervising orthodontist of these findings. Explanation. Scenario analysis. This scenario presents a challenge in maintaining compliance with fixed appliance protocols while ensuring patient safety and effective treatment. The core difficulty lies in balancing the need for precise appliance adjustment with the potential for patient discomfort or adverse reactions, all within the strict confines of established orthodontic guidelines. A certified orthodontic assistant (COA) must exercise careful judgment to identify and address deviations from standard procedures that could compromise treatment outcomes or patient well-being. Correct approach analysis. The correct approach involves meticulously documenting the patient's response to the fixed appliance adjustment, including any reported discomfort or observed signs of irritation. This aligns with the COA's responsibility to assist in patient care and maintain accurate records, as mandated by general professional practice standards, and implied by the need for thorough patient management in orthodontic settings. Promptly reporting any significant findings to the supervising orthodontist ensures that the treatment plan can be adjusted as needed, prioritizing patient safety and the efficacy of the orthodontic intervention. This proactive communication is a cornerstone of ethical and competent orthodontic assistance. Incorrect approaches analysis, ignoring or downplaying the patient's reported discomfort and any visible signs of irritation represents a failure to adequately monitor patient well-being during treatment. This could lead to delayed intervention, exacerbation of oral tissue damage, and a negative patient experience, potentially violating ethical obligations to provide competent care. Failing to document the patient's response and any observed issues is a breach of record-keeping standards, which are crucial for tracking treatment progress and ensuring accountability. Such omissions hinder effective communication between the clinical team and could lead to misinterpretations of the patient's condition. Proceeding with further adjustments without addressing the initial concerns demonstrates a disregard for patient comfort and safety, potentially leading to more severe complications and a deviation from best practices in orthodontic care. Professional reasoning. Professionals should approach such situations by first prioritizing patient comfort and safety. This involves active listening to patient concerns, careful visual inspection of oral tissues, and thorough documentation of all findings. The next step is to communicate any deviations from the expected patient response or appliance function to the supervising orthodontist in a timely and clear manner. This collaborative approach ensures that treatment decisions are informed by accurate patient data and adhere to established protocols, thereby upholding the highest standards of professional practice.